relate to you guys because the majority of you might know somebody that has passed away from cancer, know somebody currently with cancer, or if you don't, in the future you may, because cancer is the second leading cause in the U.S. Hospital. I was in the hospital by his side. And I saw what it did to the human body, and he received traditional chemotherapy treatment. And I thought, just from like viewing him, that the traditional treatment made him worse than better. So, in preview, I will be talking about the negative side effects, the causes, and the new solution. I clicked the arrow. The negative side effects of traditional chemotherapy, it occurs more severely and rapidly than anaerobic treatment. According to the American Society of Clinical Oncology in 2016, the negative side effects include severe hair loss, weak, brittle, yellow teeth, frequent vomiting, and you're constantly tired. And I included a picture of what a person's teeth would look like if they received the traditional treatment. A little girl that received the treatment, she has hair loss, and a lady vomiting. And now that we know what the problem is, we can examine what the causes of traditional chemotherapy treatment. And chemotherapy works on active cells. And cancer and healthy cells are similar because they are considered active cells. So, according to Jason Mick in 2009, the powerful medication affects cancer and healthy cells. And by this, medication is chemo. So when it goes through the body, that it doesn't have any guidance. So the medication can't determine if the cell is cancer or foreign or not. So it'll just stream throughout the body and destroy what it wants to destroy. And according to the American Cancer Society in 2015, damage to healthy cells is what causes the negative side effects that an individual that receives traditional chemotherapy treatment happens. And there's a picture of chemo. Like, when their traditional chemotherapy treatment is like just oral medication and injections. And now that we know what the problem causes, we need to find a solution. According to Adriano Calventini in 2008, who did extensive research over anaerobic mechanisms that help defend the body, said that these will directly affect the foreign cell. And to go in further explanation about that, the nanorobots, before injected into the patient, will be injected with chemotherapy, with chemo. And when the nanorobots are put into the patient that has cancer, the nanorobots will stream throughout the body, and when that happens, it will be able to detect which cell is cancerous or not, or foreign or not, to the human body. And when that happens, it will attach, it's kind of like that photo, it's like a little animation of it. It will attach itself to the cancer cell and then inject the medication into it, instead of the medication just streaming throughout the body, because if that happened, then the healthy cells will die too. In this way, just the cancer cells are being affected. And according to Janet Fang in 2015, there was a human trial done by Dr. Hugh Long. The human trial consisted of 2 females. One female was injected with traditional chemotherapy, and the other female was injected with nanorobotic treatment. At the outcome of it, the female injected with the nanorobotic mechanism had symptoms, which hair loss, teeth problems, and fatigue and vomiting. But the side effects were not as bad as the female injected with the traditional chemotherapy treatment. And the females had the same type of cancer, and they were the same age, but they varied in height and weight, but they were still close enough that it made an impact. Society and talk about it. A lot of people don't know about neuro mechanism, like the show of hands having a new, like, that existed in the medical field. Maybe people in the medical field, like, going into the medical field do that, but a lot of people don't. So if you talk about it and get it known, like, if you know somebody with cancer and they don't even know that this is possible, maybe they can go talk to the doctor and be placed on it. In summary, we talked about the problem, which is the negative side effects, the causes, which is the medication, the chemo that affects the